Welcome to the dvm365. I'm Content Manager Adrienne Wagner. Veterinarians Phyllis Sill and Ward Conover were both reported safe after running the Boston Marathon April 15th before two apparent bombs killed 3 and injured more than 100. Doctors Dale Otteson, Dave Stevenson, and Corey Mosunik also escaped the marathon unharmed. All completed the race except Mosunik, who practices in Newtown, Connecticut. Verbach Animal Health voluntarily recalled 6 lots of Iverheart Plus flavored chewables March 29th. According to a letter the company sent to veterinarians and their staffs, product testing revealed that the ivermectin potency failed to meet stability specifications during the life of the product. No adverse reactions or illnesses have been reported to date in regard to this recall. Veterinarians should communicate directly with distributors on how to dispose of the affected product. Check dvm360.com for additional details. Can you recite your veterinary clinic's mission statement? If the concept itself seems a bit lofty, consultant Bash Halow says you can still improve the overall state of your practice by applying standards of care.
Since everybody's abandoned really taking a look at a mission statement, everybody's supposed to have a mission statement, but nobody really does one, and if they have done one, they don't really look at it. I would say the next best thing is a standard of care. Because when you have a standard of care, then all of you have agreed upon, I believe, some absolutes about what you're doing on a day-to-day basis with dogs and cats and the people that own them. And I think once you've agreed upon that, then you can ask your team how they participate in delivering those services, which everyone, I think, believes is intuitive. You know, they sort of think that we'll all work together and we'll make great client care and patient care happen. And it is not intuitive. It actually takes a great deal of work to put systems in place to make sure that you deliver that care. So I think the most important start is a standard of care, an agreement upon what is the medicine that we're going to deliver to dogs and cats, and the care and the service that we're going to deliver to the clients that own them.
Be sure to catch Bash Halow at CVC Washington, D.C. on Sunday, May 12th. Coming up, Dr. Susan Little says practitioners and pet owners should lose the "it's just old age" mindset in regard to aging pets. But first, it can be uncomfortable to reprimand a team member about a personal fashion choice, but consultant Shawn McVey says it must be done, as long as it's official policy.
Managers should handle that the way they handle any problem in the business that is lack of compliance or not following the rules. It's sensationalized a little bit because it's about inappropriate dress or about inappropriate expression of self, but the real problem is this person isn't following the rules, isn't following the guidelines. So rather than focus on what they are wearing, I would focus on constructing a policy in my hospital that outlines succinctly and explicitly what types of dress are appropriate, if you will, a dress code, all the way down to how many earrings you can wear, to how much cleavage can be exposed, how low or how high you can wear certain pieces of clothing. Define for the employee the rules around how you want them to present themselves to the public, and if they disobey those rules, treat them as if they were any other employee who disobeyed any other rule. It's not about the clothing, it's about what you expect them to do in that situation. So develop a dress code or a dress policy, stick to it, and manage them out of the business if they choose not to follow the policy.
Hi, I'm Jessica Zemler, editor of dvm360.com and dvm360's iPad app. Did you know that we're on Facebook and Twitter? Like us on Facebook at facebook.com/dvm360 and follow us on Twitter at twitter.com/dvm360.
I think we do our patients a disservice if both we and our owners attribute a lot of the symptoms that we see in aging pets. If we're going to put it down to age alone, we'll be having too many cats, and this is true for dogs too, who are suffering pain when they don't have to, who are getting debilitated when they don't have to, who are suffering from diseases that could be treated or could be managed. So, you know, it's not just about wellness, it's a quality of life issue. You know, I think if we talk to most owners of older cats and dogs, the thing they're most concerned about is that their pet not be in pain and have good quality of life. So I think that's where we have the ability to educate owners so that they understand preserving the quality of life and freedom from pain comes from paying attention to all those little changes that happen.
We hope you've enjoyed this edition of The Five. If you have suggestions for future shows, email us at dvm360@advancestar.com. And for the latest news, medicine, and business information, be sure to visit dvm360.com every day. Dang it, I just want to get over.